Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a blocked left ear, and upon examination we can see that this patient is suffering from a condition called otitis externa. Otitis externa is an umbrella term given to an infection or inflammation of the outer ear. Now, more specifically, this patient has got eczema of the ear. They do also suffer from eczema of other parts of their body. And that's resulted in this patient developing excessive skin within the ear canal, which has failed to migrate. So our ear canal and the outermost layer of the eardrum is lined with the epidermis layer of skin. And as this epidermis layer of skin, which is the outermost layer of skin, underneath the epidermis, you've got the dermis layer where you've got all the elastin and collagen and all the hair follicles. So that's the middle layer, and then you've got the fatty connective tissue layer, which is the most deepest layer of skin. Now, the epidermis layer, it replicates itself, it then dies, and it's replaced by the layer of skin that it's reproduced. And that dead layer of skin should then naturally migrate out of the ear, almost in a conveyor belt motion. And as the skin is migrating out of the ear, it should exfoliate, it should break up into the individual skin cells. But in this case, you can see the skin has died, it's failed to migrate, and it's also failed to separate. So we've still got these long sheets of dead skin. And these are probably the most trickiest of procedures to perform because there's very little margin of error. Where this layer of skin that I'm peeling away is probably, I would say, 0.1 millimeters in thickness. Of course, on the screen, on the camera, it looks extremely magnified, but it's a very, very thin layer of skin, and we're having to peel it off the canal wall. And of course, the canal wall, especially the bony part, the osseous section of the ear canal, which is the inner 2/3, is extremely sensitive, so we just don't want to make contact with that part of the ear. So I'm using the fine end suction probe, and I'm just gently peeling away. So it's almost, this ear canal is almost lined in layers of dead skin, similar to an onion. And you can see some of the skin is quite dark, it's oxidized. So that's the surface skin, which is older layers of dead skin. And the innermost layer, which is still somewhat attached to the ear canal, as you can see as I'm lifting it, it's still white. So that's freshly dead skin. And this skin is also lined on the eardrum, so if you continue to watch, you'll see me also peel it off the eardrum. Now, one of the other potential causes as to why this patient's developing this otitis externa, other than their eczema, is that they have a sensitivity to sound. And upon questioning and learning more, this patient is suffering from a condition called superior semicircular canal dehiscence. And in that condition, which I'll briefly explain in a moment, you can get sound-induced vertigo or pressure-induced vertigo, and the patient suffers from both. They report that in response to loud sounds, they can get a bit dizzy. If they cough and sneeze, they can also get dizzy. And sometimes even when they're walking, the sound of the footsteps, the motion of the footsteps can get them dizzy. And to help, this patient wears more or less most of the day custom ear defenders to help block out any loud sounds, which can then lead on to sound-induced vertigo. And sound-induced vertigo, the term given for that is called the Tullio phenomenon. And so by wearing custom ear defenders, it's attenuating loud sounds and reducing the effect of the Tullio phenomenon. But when you've got custom ear defenders, it can introduce sweat and humidity in the ear, which can also help to then contribute to all this skin that I'm peeling away. So what's superior semicircular canal dehiscence? So in the inner ear, we've got not only the organ of hearing called the cochlea, but we've got the organ of balance called the vestibular system, and the two are connected, and we call that the labyrinth. And the organ of balance, the vestibular system, has three semicircular canals. You've got a horizontal or lateral canal, you've got a posterior semicircular canal, and you've got the superior semicircular canal, which is a semicircular ring, which when viewed, it's protruding upwards towards the underside of the brain. Now, the labyrinth is encased in bone, and inside the bone you've got a fluid and a jelly membranous layer. Now, with superior canal dehiscence, the bone of the superior semicircular canal, it's eroded, so the inner membranous, almost jelly-like consistency is therefore exposed, and it's just sitting underneath the skull. Therefore, because that bone is eroded, it's exposed the inside of the organ of balance. Therefore, vibrations, either caused by extreme pressure changes or loud sounds, they vibrate in the skull, and they are transmitted into the opening of the superior semicircular canal. Because that bony protective layer is not there, these vibrations can enter the superior semicircular canal, which they wouldn't otherwise if the bone was still intact. And so in response to loud sounds are not only heard through the ear by air conduction, but they are absorbed by the bones in our body, and they are transferred and they transmit across the bones, albeit not as efficiently as the sound travelling through the ear via air conduction. But yeah, we do also hear sounds via bone conduction. So the bone vibrates, so the skull can vibrate, and all the bones around the skull, and these vibrations are then picked up by the organ of balance, and it causes vertigo. So we call that the Tullio phenomenon, and it's similar with pressure change. So one of the tests that I performed in this patient was called the fistula test. I positioned my finger on the patient's tragus, which is a piece of cartilage just outside the entrance of the ear, and I quickly, with my finger, pushed the tragus in and out, so basically cupping and releasing the ear canal to induce pressure change. And that elicited some vertigo in this patient on the right side, which is the opposite ear actually to this. This is their left ear. And we also had evidence of the of what we call the Hennebert's signal. So when you do the fistula test, and when you induce pressure change in the ear, these pressure changes, fluctuations in pressure, because the bony part of the superior semicircular canal is no longer there or partially not there, these pressure vibrations enter the balance organ, the superior semicircular canal, and it tricks our brain essentially into thinking that we're moving, but we're not, and we can get vertigo. So, and we can get the Hennebert sign, which is also nystagmus of the eyes. So within audiology and ENT, we quite often assess one's balance by viewing their eyes. There's a response called the vestibular ocular response. So our eyes pick up deficiencies in our balance. And when you do the fistula test, the where I just described, where you cup the tragus in and out the ear canal to induce pressure change, if the patient suffers from vertigo, you can actually see their eyes beating, and we call that nystagmus. And I noticed a bit of Hennebert's, we call it the Hennebert signal in that particular test. So the patient also mentioned experiencing vertigo when they walk sometimes, so their footsteps, so they're actually sensing their footsteps. Those vibrations have been transferred from all the bones in the feet, up the spine, into the skull, and it's been picked up by the organ of balance, tricking the organ of balance to think we're moving in a certain direction, so they get dizzy when sometimes they even walk. And one of the other tests I got the patient to do to try and confirm that condition is I asked them to look upwards and roll their eyes to the back of their head almost, and then roll them left to right. Now, normally you wouldn't be able to hear, so you can do all this to yourselves right now if you wish. If you roll your eyes, you shouldn't be able to hear that inside your head. If you do hear that, that's another indicator for superior canal dehiscence. So the motion of the eyes rolling side to side, the vibrations are transmitted to the bone, and because the superior semicircular canal, there's a dehiscence, the bone is missing, so these eyeball motions and vibrations are entering the organ of balance, and we can get vertigo. For true diagnosis, the patient will need to go undergo a CT scan, so I referred the patient on. And yeah, you can get a sensitivity to certain sounds because, again, sound waves are travelling through the bone and being picked up via the organ of balance. So they enter the organ of balance, and then they then, via the organ of balance, enter the organ of hearing, stimulating the organ of hearing. So they get super elevated levels of hearing when it comes to bone conduction. So when you do a hearing test with someone with superior canal dehiscence, quite likely you're going to get a low frequency hearing loss via air conduction, because in the same way sounds can enter the superior canal dehiscence, vibrations can enter, sounds can also escape. So when we put headphones into this patient's ear and we did a hearing test, the sound enters the ear, hits the eardrum vibrates, and typically the vibrations are transmitted through the three little bones in the middle ear called the ossicles to the organ of hearing via the three bones, and the stapes bone in particular, which is the smallest bone in the body. But if you've got dehiscence, some of that sound energy will escape through the organ of balance out of that dehiscence. So again, that bony capsule helps to trap sounds inside the ear, preventing them to escape so we can hear them. So when you do air conduction, some of the sound is escaping, so you will get a low frequency hearing loss typically. But when you perform bone conduction, they'll have better than normal bone conduction threshold, so we'll get a big air bone gap there. So and the reason why I'm explaining all this is I know a lot of audiologists watch my channel and they find it an educational guide. So I'm sorry some people object to me explaining all that, but it's great to mention it because it's not something that I've probably discussed before, superior canal dehiscence. So there is surgery where they can patch up that missing bone, that's performed by ENT, but of course they need to be fully diagnosed. Another symptom is occlusion or autophony. You can hear your internal sounds, especially your own voice, because again, your own voice, when we speak, we hear ourselves through air conduction and bone conduction. So our voice travels out of our mouth, enters the ear canal, hits the eardrum, and we can hear it, but it also vibrates the bone. We get bone conduction, and with the superior canal dehiscence, those vibrations of your voices are, again, entering the organ of balance, which they otherwise wouldn't because it's protected by that bony capsule. But in the absence of the bony capsule, it's entering, vibrating the jelly membranous inner section, and so these sound waves then are travelling through the organ of balance into the organ of hearing. So you can quite often hear yourself a lot louder with this condition. So the giveaway thing was, this patient mentioned when they got water, they try and avoid water getting into their ear, but when they go swimming, it's the pressure of the water that really elicits their dizziness. And they mentioned about the footsteps, the vibrations, and then the sensitivity to loud sounds, and then the coughing and sneezing that can get them dizzy, and the fact that they wear ear defenders, the fact that they could hear their own eyeballs vibrate. And when I did the fistula test, they were getting dizzy. I could see their eyes move. So there's loads of symptoms, diagnostic, clinical markers there. So we referred the patient on. You can see we gently peel as much of that dead skin as possible. The patient also has medication for their otitis externa. I hope you enjoyed the video, guys. Take care. Keep